As we head into a new year, it is now more important than ever to discuss the topics and utilize the tools that will move our Jewish community forward.
We're still connected.
Time to say goodbye to 2020.
Groups that we share the same values with.
Experiencing on your own terms.
Connecting through Judaism.
You show up because this matters.
You feel a part of something.
A series of inspiring events leveraging the leadership of Bay Area community builders, philanthropists, rabbis, academics, and professionals. People just like us who are working to make our local communities safe, equitable, and resilient.
Welcome to the Day of Philanthropy Festival, and thank you so much for joining us. Lily Cantor and I are your co-chairs, and in partnership with the extraordinary staff at the Jewish Community Federation and the Endowment Fund, we've taken advantage of this, I would say, very unique year to transform what was once our annual Day of Philanthropy into a festival of philanthropy, one that brings what we believe are the most important issues today with the very best speakers, critical thinking, and really top of mind conversations right into your living room. The purpose of the festival, as Lily and I have curated it, is to have these discussions really openly and authentically so that together we can strengthen the Bay Area Jewish community with a secure Jewish ecosystem and a shared responsibility for our future.
The global pandemic, COVID-19, has dominated the focus of our entire world this past year. We still have so many questions about how we got here, what does this mean for our society and the world at large, and what will be our next normal look like? The Bay Area is home to some of the finest leaders in medical and philanthropic organizations partnering to fight this virus. We are so fortunate to bring two of them for you today, Dr. Larry Brilliant and John Pritzker. Dr. Larry is a physician and epidemiologist, CEO of Pan Defense Advisory, and CNN's medical analyst. He lived in India for nearly a decade, where he was one of the key members of the World Health Organization's smallpox eradication program for Southeast Asia, as well as the polio eradication program. Dr. Larry's memoir, Sometimes Brilliant, is his personal, spiritual, and professional account of leading a team to eradicate smallpox. This is a phenomenal book, and I highly recommend it. John is the founding partner and director of Geolo Capital, where he oversees all sectors of the San Francisco-based private equity and investment firm. His illustrious career in the hospitality industry has spanned the globe for over 4 decades. He is the chairman of the John Pritzker Family Fund, whose mission it is to help people lead fulfilling and healthy lives in vibrant communities. The complete and impressive bios for Dr. Larry and John can be found in the speaker biography section below. We are thrilled to have these two change makers with us today to give us an update on the pandemic, the vaccine, and what lessons we as a community can take away from this experience.
Since this pandemic struck, we all know that Federation has been working right alongside all of our partners every single day to address the urgent needs of the populations that have been most impacted by the COVID-19 crisis and to stabilize our Jewish ecosystem. At the end of this event, you'll have an opportunity to learn more and to do more to advance this work. But for now, sit back and enjoy the conversation.
So Larry is, by my estimation, a legend 3 times, probably more. Number 1, he's a world-renowned epidemiologist. Number 2, he was a key member of the team that eradicated smallpox from the face of the earth. But number 3 is where I first heard of Larry. In 1970, Larry and his wife Gurja and Wavy Gravy and his wife Janahara and their merry gang cobbled together a bus to travel to Bangladesh to feed and provide medical care after the Great Bola cyclone. And it's safe to say insanity and compassion ensued. I heard of that adventure not long after it happened, And I, for years, fantasized what it must have been like to be on the bus. And in fact, it was the ethos of Larry and Wavy's trip, among other things, that motivated me to move to the Bay Area in 1971. And for that, I am deeply indebted to the two of them. One day around, I think it was, Larry, the year 2000, I actually met Larry and Gerja at my house. We had a fundraiser for the school that our kids attended. And when I realized it was that Larry Brilliant, as opposed to the myriad of other Larry Brilliants, I introduced myself, and he remains today a hero and a close friend. It's safe to say Larry represents the best of my generation, not only for his work in medicine, but in so many other ways. We'll delve into Larry's past and influences in a bit, but for now, I want to jump into some questions for Larry. And Larry, as always, I'm thrilled and honored to spend any amount of time with you. I want to assure you, Larry, as I told you recently, I hold an honorary degree in rocket science, but I want you to know that I'm going to keep the questions very simple for you.
Thank you.
So my first question, Dr. Brilliant, when will we need to wear pants again?
You know, it's true, the urban legend is true that Walmart's has sold out of shirts, but has a very large supply of pants.
I'll take that as the answer. I do remember in one of my early interactions with you, you were talking to me about a pandemic. And to be honest with you, I only tangentially understood a pandemic. And I think you said then they occurred every 75 years or so, and that we were overdue for one. Can you give us a quick history of the pandemic?
Day one, they're humans. Day two, they're pandemics. I mean, it's as far back as we know. The Bible, our Talmud, our Tanakh is filled with stories of pestilence, as they're called, and whether they thought it was leprosy or they thought it was the fiery dragon, which was dracunculiasis or smallpox or polio. These are all ancient diseases that, in their time caused the Black Death and caused some of the great cholera pandemics of all times. As long as there have been humans and animals from which the virus springs, there have been epidemics and mostly pandemics. The idea of it occurring every 75 years or so is just taking the big pandemics and dividing them by years. There's no guarantee. And that, of course, is one of the biggest problems. When you and I met and we talked at John Doerr's house about how likely it was to have a pandemic like this one, it was always a question of not if, but when. And it wasn't just me and the Cassandras that, we're talking about it all the time. Every epidemiologist would have been able to say exactly the same thing. It's just a question of when we get unlucky and a virus that is in non-human primates, chimpanzees, or it is in bats, or it's in chickens or wild ducks or pigs, it will jump from an animal to a human. And if we're unlucky, that virus will achieve the exit velocity. It will mutate through genetic shift or drift or reassortment and take on the characteristics of a virus that is transmissible for humans. We had a big one in 1918. People talk about that all the time, but we also had a very large one in 1957 and 68. Each of those killed more than 1 million. This weekend with Rabbi Sid Mintz, we had a yard site for the nearly 2 million people worldwide that have already died from COVID, from this disease. And we had it this week because we're now celebrating, observing the yard site of the first person who died from COVID almost exactly a year ago today.
You mentioned the get-together at John Doerr's house. That was to discuss your TED Prize. And I recently watched the video of your acceptance. That was 2006. And in it, you outline what will happen when, not if, the next pandemic occurs. I'm now struck by the prescience of your comments. And as a result of your winning the TED Prize, the TED community grants a wish. Can you tell us a little about what your wish was?
Sure. It was a wish that the world create an early warning system to warn us about pandemics, and to warn us when viruses have jumped from animals to humans. Because any delay, let's put it a different way, any head start you give the virus, a virus that moves at exponential speed, not a good idea to give it a 6-month head start, as we did with the first Ebola outbreak and as we've done historically with diseases. I'm pleased to tell you that when we met and when I did that TED lecture, on average, it took 6 months from the time a novel virus jumped from an animal to humans. And because of all the digital disease surveillance systems that were started by Google and others when I was at Google, now there's so many of them, the average time that it takes to detect a new pandemic before it starts is 21 days. So we've gone from 6 months to 21 days, which is really good. It's not good enough, but the trajectory is right. In this case, it's always a government which hides the early causes of a pandemic. It seems to go along with the territory. This one was no different. China was late, but still, it was only 18 or 19 days after the first case that we had a full genome. And the Chinese say they did the first genome, but it was actually the Thai government that did that. And they released it to the world. And as sad as it may seem for Americans, the rest of the world used that genomic uncoding to create the first tests. The Germans did it and gave it away free. WHO promoted it. And the rest of the world had adequate testing almost less than a month after the first case. We still don't have adequate testing in the United States. It's one of the real tragedies.
So let's fast forward to today. What's your assessment of where we are currently with the virus?
I think we're in the worst peak to date. Anytime an epidemiologist coughs in the middle of a pandemic, you're required to say that's not COVID. I think we're at the worst peak, but there's going to be a great number of peaks after this. That the virus will continue to increase. I think maybe we'll hit a temporary plateau. All of this is a cadence or a timeline that began with Thanksgiving and then Christmas and then New Year's. And you sort of count 2 or 3 weeks after the last holiday that we have like this. And you'll see when the cases will reach their peak. And then 2 or 3 weeks after that, the hospitalizations and people going into ICUs. And then inevitably the deaths, which will usually follow by about 6 weeks. So I'm looking at New Year's Eve, the time right between Christmas and New Year's, as being the last of those 3 holidays. And I'm looking into early February before deaths will begin to plateau. When we talk about numbers like 4,000 deaths a day or 5,000 deaths a day, it isn't that we don't know that every one of those deaths are a human being, a brother, a sister, a cousin, a mother, father. But in order to put your arms around something as large as a pandemic, we frequently, epidemiologists are particularly guilty of this, we just revert to numbers. And if I do that again, I apologize. But we might hit 5,000 deaths a day. And in fact, I wouldn't be surprised if the total number of deaths in the United States, by the time the death rate begins to come down, that it might exceed 500,000 deaths, 500,000. Just for reference, in 1918, the worst pandemic in 100 years or more, the total US deaths were 600,000. So we're almost certain to go beyond that. These are horrible numbers to have to contemplate.
Larry, and I don't mean this as a political statement, is that a function of national leadership?
It is. It is. I mean, when we did the movie Contagion, or when I did that talk at TED, all the epidemiologists I know would have agreed on how the virus was likely to behave. We figured it would be a respiratory disease. We figured it would begin somewhere in China or Southeast Asia. We figured that it would spread quickly and that it would take a year or more to get the vaccine. What we didn't figure on is a total absence of a federal government leadership response in the United States. And that's important not only for the horrible situation in our country, where with 4 or 5% of the population, we have a full quarter of all the deaths, a quarter of all the cases. It's horrible for the rest of the world, which always relies on US leadership, particularly CDC leadership, as we have for Ebola and for Zika and for swine flu and bird flu. The absence of leadership, the disinterest that we've seen from the federal government, the disintermediation of CDC that we've seen, the politicization of things like masks that should, God help us, never be political. The virus doesn't care whether you're in a red state or a blue state or how you voted. So these are horrible things, John, and we're not over it yet. It continues.
So the Biden administration's coming in. By discipline, what would your dream team of leadership be?
Oh, I think they've got it. You start with Ron Klain as chief of staff, a good friend of mine, somebody I respect immensely. He was Obama's Ebola czar. He knows what you need to do to control disease, and more importantly, I think he knows how to get it done within government. And then the task force is terrific. Vivek is wonderful. David Kessler, these are great people, and the whole task force is great. And the new head of CDC is going to be terrific too. So I'm very optimistic about that team.
If you're happy, I'm happy. Let me ask you, the Bay Area was doing so well until relatively recently. What happened and why?
We're still doing really well. It is unfortunately graded on a curve. We have 1/10 the per capita COVID as Los Angeles, for example, not to pick a Dodgers Giants battle, of course. But we've done very well. And beginning, of course, with Mayor London Breed's prescient shutdown declaration, emergency declaration, way beyond and before any other mayor. The state followed her by 1 week. And so California became the second state. We were the first city in San Francisco. And I think she's got a great team. We're very closely tied into Biden's task force, several people from UCSF around the task force, great people. So I think we'll continue to do well. But it isn't just the mayor and it isn't just the scientists. The culture in the Bay Area is we believe in science. The mask wearing in the Bay Area is over 85%, and it was 10 points higher than the rest of the country at any time. And, if you just walk around in San Francisco, you won't find very many people who who believe that it's a hoax. So I think we're in pretty good shape comparatively. No matter how good we are, we can't be safe in the Bay Area until we're safe everywhere. And that includes the whole world, not just the rest of California.
What do we need to know about the mutation of the virus?
It's inevitable. It's an RNA virus, which means it has a single strand. And as it replicates, unlike a DNA virus, which has 2 strands, in a DNA virus, the second strand serves as a spell checker on the changes in the opposite strand. Influenza virus, which is an RNA virus, probably mutates, 1, 2, 3, 4 mutations a month when there's an outbreak of influenza. Coronavirus have something which is akin to a spell checker, that is the one who checks to see if during reproduction there's an error made in the transcription of the nucleotides. So it doesn't mutate as much as the other RNA viruses like influenza, but it does mutate. And we've probably had, there are so many estimates, but probably 100 mutations in the year since COVID first was a novel virus.
Well, why now then are people seem to be focused on it?
Sure. So when you've only got 10 people sick, and each person, for argument's sake, has thousands of viruses, that's the number of cycles of reproduction the virus will go through. And if mutation occurs at a kind of fixed rate of X%, it'll be a very low rate the first month. When you get into the hundreds of thousands, the rate at which there'll be mutations increases. When you get into the millions, it will increase. And we will get into the billions of people. And the rate of mutations will increase dramatically. Because if there is a mutation, it's under evolutionary pressure, survival of the fittest, to be able to be more transmissible at least. And so it will eventually crowd out what we call the wild type, which is what you've seen in the UK. The explosive outbreak in the UK is caused by the wild type of going away and ceding its spot, so to speak, to the novel, to the variant or the mutant, as I think of them. And that mutant, that variant, B117, catchy name, is 1.5 times as transmissible or 1.7 times as transmissible. So you're going to get more and more mutations the more cases there are. It should make us say, oh my God, we've got to really work quickly to throw COVID into the dustbin of history, to lower the viral burden. That sense of urgency has been lacking in the federal response, as if they don't understand that the vaccines that we make, as good as they are, the antivirals, all of these treatments, they are at risk of a mutation getting worse and worse and able to escape the vaccine, escape the treatment. So far, we're fine. The vaccines we have now have not, the virus has not escaped. It works for all the mutants that we know. We're going to have a little trouble with the monoclonal antibodies, but not with the vaccine. So everybody should be confident that if your number is called and you get an invitation to go get a vaccine, go get it. But 6 months from now, if we haven't reduced the number of people with COVID and we have the same rate of increase in mutations, I'd worry about that.
So speaking of the vaccine, when do you think the majority of us will end up being vaccinated?
In the United States, the answer would be quite different than it would be in any other country. Canada has ordered 300% the vaccine that they need to vaccinate every person in Canada twice. We have 150% of the vaccine that we will need to vaccinate every person twice. Most of the world, it's like 20%. We should just be aware that the developed countries are sort of hogging with advanced purchase contracts most of the vaccine. But just for a second, zeroing in on your question to be the United States, because we have 200 million doses of Moderna's vaccine and $200 million of Pfizer and 100 million doses of J&J, which I expect will get an emergency use authorization next week or the week after. That's immediately 500 million doses. And the J&J vaccine only requires one dose. So that's enough for right there, 300 million people. So we're in good shape. It's a question of figuring out how to be more efficient at distributing the vaccine. And there are some ideas, like if anybody is contact traced, either through one of these apps like the Google Apple app or just through regular contact tracing, they're offered a vaccination immediately. That would speed things up. If we start thinking about doing what we did in the movie Contagion and have a lottery and then have 24/7, 7 days a week, large vaccine distribution places take over the arenas and the coliseums and work all around the clock. We need to do everything we can to get as many people vaccinated as quickly as we can. It is really a race against time.
And what indicators do you look for to indicate we're headed towards a pre-pandemic normal? And will there be a pre-pandemic normal?
No, that is the, we don't do $64,000 questions. That's the $64 trillion question.
I was going to say in today's dollars, right?
Yeah. Well, ironically, I think what will make us feel more normal is the speed at which testing is advancing. Right now, the only testing that I feel really confident in is PCR testing. The antigen tests are getting better and better and better. Soon they will be good enough to really be used. They're really better now for confirming a diagnosis in a hospital or doctor setting than they are in general asymptomatic surveillance. But we're very close to seeing that all change, and that we will get either a rapid PCR test or we'll get one of these great CRISPR tests that use a telephone camera to read a bioluminescence created by the CRISPR test that both UCSF and the Broad Institute at MIT are working on. We will have solid tests that you can do at home with saliva in the privacy of your own bedroom, and then just take that saliva and put it in a little vial, and your camera in your phone will tell you if it's positive or not, and you'll be notified and your doctor will be notified. Once that happens, things will start getting more normal because we'll be able to go into congregate areas. Live music will return. You'll be able to go to indoor restaurants because people will be able to be tested 3 or 4 or 5 times in a row, 5 days in a row, at a very low cost, because these tests are going to be $5 to $10 each. It's the price of testing, the delay in getting test results back, that make it so difficult. We know what to do. I worked on the Democratic Convention, and for those of you who are listening who are Republicans, and then I offered those protocols to the Republican Convention in order to keep people safe at that convention. We know how to keep areas safe. I did the same thing with my colleague, Ian Lipkin, for the Directors Guild and all the other guilds in Hollywood. We know how to do it. We know how to keep a Hollywood set safe or a national convention safe, but it's really expensive. It's multiple tests, and you can't afford that if you want to send kids back to school. It doesn't, but we know how to keep schools safe, but the cost needs to come down in order to make it practical. And that's happening right now. And I think that will make us feel more normal. And in the same time, the vaccine being more distributed will make us really be safer. We're not going to sense that. You're not going to feel safer because 20 million of other Americans are vaccinated or 80 million are. You won't perceive that difference, but you will perceive the difference if the schools are open and restaurants are open.
And at the risk of sounding self-interested, will travel open up a little more at that point?
Oh, absolutely. It's not just you being self-interested in that. I've been working with Virgin, and they have many of the same issues. The travel industry has been hit so hard, but I expect that testing will make the travel industry come back to life, even before vaccines come anywhere near mass vaccination or herd immunity, which is a little bit of an elusive unicorn. But the testing being available in sufficient quantity at a sufficient price will really make hotel stays more possible, airplane travel more prudent.
So can we move on? I'd like, and I'm sure people will ask questions about vaccines and other issues around the virus. I'm curious about your journey as a seeker and a visionary, and to what extent all of that was informed by your Jewish upbringing in Detroit.
I thought I had the ordinary career path in the 60s. I went to synagogue, and then I ran away to California. Then I joined a hippie bus and drove to Kathmandu, lived in an ashram, went to work for WHO. I thought that was the normal. I mean,
it was then, actually.
But it felt like that was normal in those days. Yeah, I don't think that I would have been able to see the beauty, the pleasure, the inward satisfaction of service if I hadn't heard the words Tikkun Olam, let alone begun to understand them. They have been so critically important in my life. I've tried to understand the Sanskrit version of that and the Arabic version of that and the New Testament version of that. And if you search far enough, it exists in most religions, but it's in Judaism that I found that Tikkun Olam. When I was living in an ashram with my teacher, Neem Karoli Baba, and he told me to go work in the smallpox program. And he said, because this is your destiny. But he really said, this is your path. And then he said, and there's a name for your path. And he gave it in Sanskrit. It's Nishkam Karma Yoga, but it translates into Tikkun Olam. And so I think that Temple Israel in Detroit, where I grew up, sort of, planted all the seeds.
The organization, the name of it is behind over your shoulder, Ending Pandemics, I think was spun out of the Skoll Foundation. Do I have that right?
Ending Pandemics was spun out of the Skoll Foundation, and we started funding it when I was at Google, and then when I moved to Skoll. It's run by Mark Smolinski. Peggy Hamburg, who was the head of the FDA, has just succeeded me as the chairman, and she's the chairman now, and I'm still a board member. And it is a wonderful organization that's trying to prevent the next pandemic, because if you haven't gathered already from what I've said, we live in an age of pandemics. Modernity itself both gives us the tools to treat pandemics, but certainly creates the opportunity for viruses to jump from animals to humans, and then to get on a 747 and fly everywhere in the world in 16 hours. So Ending Pandemics works in 37 high-risk countries, coordinates 12 or 13 foundations that fund in the area of pandemics, and creates these early warning systems that I mentioned earlier in respect to the TED Prize. And they are working. They are speeding up our finding new outbreaks faster. And if the response is as fast as the finding of them and as good, then we will be able to deal with future pandemics. But that's an area that really needs help because it's so hard to prove a negative. Prevention has no fans. We don't think of it. It's not kind of a Western concept how important it is. Your parents may have told you that a stitch in time saves 9. In the area of pandemic prevention, a stitch in time saves 9 million lives.
You wrote a book, Sometimes Brilliant, and I can't recommend it highly enough. I, of course, did not get a signed copy, but some people did. And you wrote about, I assume your video is frozen or you're making a face of stun. You wrote about how the world put aside their differences and worked together to eradicate smallpox. You were a key player in what was, I think, about a 10,000-year-old disease that killed more than 500 million people in just the 20th century. How has that experience informed your work now on this virus?
I can't get over the fact you didn't get a signed copy.
No, I had a hard time moving on with the question myself.
you're
I soldiered on.
You're definitely going to get one. In fact, you'll get more than one. But probably some of the inscriptions you'll have to keep private.
Fine, it's a deal.
I joined WHO as the mascot, the Bat Boy. I was the youngest person to ever work for WHO or to work in the smallpox program. And I stayed in India for 10 years. So the people who really knew and had spent their lives, like Bill Foege and Nicole Grasset, D.A. Henderson, M.I.D. Sharma, these folks were my teachers. And over a course of 10 years, I got to visit every country and county in the world that had smallpox, which was a lot. And we had a new strategy, and it's important when we think about COVID in this context. Mass vaccination never worked. Herd immunity never worked in smallpox, and it didn't work in Ebola or many of the other diseases. We had a new strategy, which is we would find every single case at the same time in the world and draw a circle of immunity around that case by vaccinating people. And when we did that, and we finally got that cooking after 4 or 5 years getting started, we eradicated smallpox in 18 months in India, when previously there were 250,000 children dying every year from smallpox. Watching that, the strategy of it, the commitment of the people who came before me, on whose shoulders I stood in real life, it changed me forever. To see, there's one time that I went into a railway station in Bihar, and I saw 5,000 dead bodies, all babies whose bodies were stacked like cords of wood. And to go from experiences hard and gut-wrenching and terrifying as that to seeing the last case of smallpox, which I did. I saw the last case of variola major, the bad kind of smallpox, a little girl named Rahima Banu. And I visited her in October 1975.
So I'm not imagining it. I did see a picture of you with her with a yellow balloon.
No, you saw a picture of her with a yellow balloon. I took that photo. And I only recently, for the first time ever, saw a picture of me with her that I didn't know existed when a Japanese film crew in the 70s had taken the picture. But I just saw that myself for the first time.
That's pretty special. Larry, what role did bleach play in the?
Yeah, bleach was really important for wiping down the surfaces in laboratories with spilled viruses.
Our donors and donor-advised funds at the Jewish Community Federation have been incredibly generous through their support with their support through COVID relief. I'm curious, what are some of the needs that you've been seeing out there that aren't being met?
Well, I would divide. There's only three things you can do in philanthropy, I believe, in the pandemic. And one of the things that stop it, the one you have right now. Others are those that mitigate the harm that it causes, the sickness, the death, the economic consequences. And the third is to stop the next one or prevent the next one. Those are the three big categories that philanthropy works in. I would say in dealing with helping to throw COVID into the dustbin of history alongside of smallpox and polio, which is very close to being eradicated. I think we need some research money on novel ways to use vaccine. We don't have enough vaccine worldwide. We have to figure out strategies on finding exactly the community to vaccinate first that will stop the disease. And some of that is the history of Ebola. That strategy worked in Ebola in the Congo 2 years ago. It worked in smallpox. So we need help funding the research, and WHO is having a meeting tomorrow, as it happens, on the subject of how do we do these unique or clever strategies that don't require as much vaccine, but give us as much public health bang for the buck. That's something that is underfunded. And then more importantly, or maybe not more importantly, equally importantly, is the world that is working on stopping the next one, preventing the next one. Working with animals, veterinarians who are also epidemiologists. If you think of the epidemic curve that goes like this and then down like that, if you're lucky, we want to move that curve 2 steps to the left when the disease is still in animals, even before it's jumped. What viruses are there in chimpanzees and bats and cows and birds that if they do have a bad mutation can infect humans and create a pandemic? How do you stop those? How do you do surveillance in animals? How do you do vaccination in animals? We have eradicated one animal disease, rinderpest. So we know that it's not necessary for the monkey to put their paw out, so you vaccinate them. We did run into that problem with yellow fever. But we should be able to do better at stopping diseases before they become human diseases, not wait until there's 1 million people infected. That needs philanthropic support.
I'm sorry. I remember in 2006 when you were talking about the TED Wish, there was animal surveillance and GPS involved, I think.
Yep, and that has never been funded.
And still hasn't been.
Well,
and yet we have the technology.
Oh yeah, I mean, a country like Thailand, surprisingly, has just done a phenomenal job of linking animal husbandry, forestry, economic production of cattle and meat and chickens into disease prevention. It's really interesting. They have what they call a sin tax, the taxes that they gather from prostitution and cigarette smoking. That all goes into a fund that does work to do early detection in animals. And as a consequence, Thailand's one of the safest places in the world with regard to the pandemic, and was one of the first places to find and respond to it. So if Thailand can do it, why can't we?
Right. Yeah. Are there any technologies or vaccines you're particularly excited about? I'm curious as to your view as between Moderna, Pfizer, and whatever it is J&J will be coming out with.
Well, J&J is exciting because it's only one dose. I confirmed that this morning. And it's also exciting because it doesn't require much refrigeration in the same way that these two mRNA vaccines require. So in that regard, the J&J vaccine and probably the AstraZeneca vaccine, which are based on a kind of common cold virus, the adenovirus, on which you put some of the COVID characteristics, those vaccines are probably going to have longer legs than the mRNA vaccine, in that it will go all over the world. It's less expensive to make it. You can make more of it faster. So that's exciting. I would really love to see more experiments with the mRNA vaccines to other diseases. It's such a clever, breathtakingly interesting new technology. And the vaccine that I want to see for eradicating this disease, if we ever could, put an asterisk on that, because as long as great apes and mink and cats get the disease, you can't talk about eradication. But we'll come back to that later. If we don't figure out a vaccine that can be developed, so it's one dose, no cold chain, not an injection, either a mist or a drop, so it's easy to distribute, and develops immunity very quickly so you can give it to people who've already been exposed, then it's going to take us a really long time to conquer this disease worldwide. And make no mistake about it, while people may have different feelings about the United Nations or WHO or globalization, it doesn't matter what our feelings or politics are. In the case of a pandemic, it's proof of why we need international cooperation. We never could have eradicated smallpox or polio without all the countries of the world working together. We will never stop COVID without the countries of the world working together through WHO. It doesn't matter what your politics are. There is no way that a single country can stop this disease, because the moment it's stopped here, it's someplace else and it will come back here. So those are the things we really need, philanthropic help and ideas help as well.
Has our country's issues with World Health Organization inhibited the global efforts, or have they soldiered on in spite of us?
They've inhibited our efforts. The rest of the world has soldiered on.
Yeah.
You know, I sometimes talk about COVID being a Dickensian kind of disease, the best of times and the worst of times, but it's also a tale of two cities, a tale of two countries. If you talk to your friends, if you have friends in Vietnam or in Singapore, in Taiwan, in Iceland or New Zealand, even in Germany, they look upon the horrible slaughter that we've had in the United States from COVID, and they look at you and they say, "What's wrong with my American friends? You're always the leader. CDC is always the leader. What has happened to you? Why has this virus affected you? You've got the best science. You've got the resources." It's a tale of two countries. For a quarter of the world, COVID is no problem at all right now. And that's the issue. WHO and the countries that have succeeded are doing fine. We are the ones who are hurt the most by leaving WHO. But I must tell you that in a call with WHO a couple of weeks ago, when it became more certain that Biden was going to win and rejoin WHO, many of the people started to applaud and said to me, "Welcome back." Somebody else said, "No, there's no welcoming back, because you guys never left. You may have thought you left, but what you really did is you issued a press release that you were thinking about possibly considering leaving. So welcome back." It's like a marriage that you were thinking about getting a divorce, but you never divorced us.
So, Larry, will you give us something we can hold on to as a harbinger of better times to come?
Yeah, I mean, I look sometimes at sports because it's such a melting pot in the United States, at least, and global sports like soccer. The NBA was so successful at having an abbreviated season in a bubble. They proved that it was possible. And they did it by using diagnostic tests for a purpose they've not been used for prior to COVID. They're using these tests normally used to diagnose, do you have the disease or not? And instead using it exclusionarily to exclude people who test positive, and to, by testing people every single day, watch the virus develop, and you can catch or see or test positive of the virus days before it's infectious. That's a key issue in this testing. You can actually find somebody who will be infectious before they're infectious.
Oh, wow.
And not let them into your hotel, not let them into your sports arena. So I think that as that idea permeates the world a little bit more, and it's not just used for the NBA or the political conventions or for Hollywood. And as those tests become more user-friendly and they become more like pregnancy tests done at home by yourself, in this case using just a swab of saliva, the world will begin to open up, and you'll begin to feel like it's more normal. That's the first harbinger to me that things are getting better, because right now we're in the really bad part of this pandemic. It could go either way right now. It could we could ride with the wind at our back as we enter into the spring season, where weather gets better, people go outdoors, there's less congregate activity, less indoor spreading, no major holidays between New Year's and Memorial Day that are big enough to really affect the whole country's epidemiological situation. And if we're smart and we use that opportunity to double down on vaccinations, on testing, tracing, isolation, and vaccination, if we really put the pressure on things right now, I like Biden's guarantee that we'll vaccinate 100 million people in 100 days. I definitely think it's doable. If you think about that, if you vaccinate 100 million, there's only 230 million more to go. If we do that, you'll begin to feel better. And right now, COVID fatigue, people's feeling of hopelessness, even the little competition about who gets the vaccine first, this has the potential of going along political lines. I have a paper coming out next week in The Lancet, which looks at mask wearing percentages by states. And you can almost see the red states have a much lower mask wearing percentage, and therefore they get bigger outbreaks when they occur. The blue states have more small outbreaks, far less disease overall, and there's more mask wearing. We have to really not do that anymore. It just doesn't make sense. When Biden says everybody should wear a mask, that's not a political statement. So those are the things I look for: the depolitization of masks and social distancing, sports and other entertainment venues, hospitality industry, John, beginning to get back a little bit to normal, and this feeling that more and more people are getting vaccinated. And when you see that the cases are going down in the vaccinated community with your own eyes, and you believe that that's real, then you'll feel that we're on the right direction home.
Well, you've reminded me today that every time I talk to you or I'm with you, I feel a lot better than I did before I was with you.
Good.
And I'm sure that everybody in the audience today will feel the same way. On their behalf, I want to thank you for participating in this, and also to thank you for everything you've done to keep us, our country, and the world safe and healthy. You're one of a kind, and I simply adore you. So thanks for today, Larry.
And John, I treasure your friendship. You're one of the best people that I know. So
Oh, you're too kind. I'll call you after I get my signed copy. I'm excited.
it's a deal.
Okay.
You have
Thanks,
a color,
Larry.
you have a color ink that you would prefer?
Tie-dye.
Of course. Of course.
Silly. Thanks, Larry.
Wow, that was amazing. Thank you so much to John Pritzker, to Dr. Larry Brilliant for taking the time to join us today to have this really important conversation. You shared information on the background of the pandemic, the context of where we are, and most importantly, where we are headed and what we can look forward to in the future. So thank you for your leadership. We are lucky to have you in our community. This conversation was illuminating and hopeful at a time where we needed it more than ever, because the future is so uncertain. You heard Dr. Larry Brilliant say that Tikkun Olam, when he learned about it, helped plant the seeds for his work today. Tikkun Olam is Hebrew for repairing a broken world. And along with the Jewish values of tzedek, which mean justice, and kehila, which means community, these are the pillars on which the Federation stands. The Federation is so proud to have been at the forefront of COVID relief in our community, having granted more than $17 million to help our community face the most urgent human needs, whether it was related to direct assistance, loans, scholarships, to help our families think about how they could survive job loss and food insecurity, as well as stabilize the Jewish ecosystem, the organizations that are so important to us and so necessary to build community. And it's only possible because of your generosity. So I want to say thank you so much for all you do now and into the future. If you enjoyed today's session, I hope you will join us for our next Day of Philanthropy Festival event, which is next Friday, a week from today, on January 22nd at 11 a.m. I'll be joined by my colleagues, Rabbi Michael Lezak from Glide, some of his colleagues from Glide, UCSF, as well as our special guest, Mayor London Breed, who will answer some questions for me and Michael about how COVID is impacting the most vulnerable in our community. It's a great opportunity to learn more about what's happening in our backyards. So please join us. I want to take a minute just to thank all of our corporate sponsors who have made the Day of Philanthropy Festival possible, especially the Seligman Family Foundation and the Laura and Gary Lauder Family Venture Philanthropy Fund. Thank you. And thank you again to our co-chairs, Tina Sharkey, Lily Cantor, our speakers today, and of course you all for joining us. I look forward to seeing you next week. And until then, stay safe, stay healthy, and Shabbat Shalom.